The rash disappeared, and he's feeling strong and normal. Today, 24 months after presentation, he put his weight back on. He's very muscular. He's on his horse every day. He's throwing hay in the barn. He's fixing wells, working sometimes a 12-hour day, feeling normal in every way. Rheumatoid arthritis. With rheumatoid arthritis, people have an elevated rheumatoid factor in most cases, symmetrical arthritis, especially of the peripheral joints with pain and swelling, pannus development, which is granulation tissue, which stimulates inflammation with a resulting loss of cartilage and bone, extra joint manifestations such as heart disease, other blood vessel diseases. X-rays show loss of bone in the joints, narrowing of joint spaces, erosion of the joints. And this is an early case. This is the hands of one of our patients. Goes on for a long time and starts looking like this. Mrs. AE. This is the same patient I presented before. 47-year-old radiology technician, rheumatoid arthritis plus systemic lupus. Perfectly normal until she had dental implants in '99. And soon afterwards, she developed autoimmunity with severe joint pain. Previously treated for many years with normal therapy, developed bone loss, anemia, etc. Enbrel and Areva cost her $1,800 a month with terrible results. The Humira actually caused her to have a lymphoma. She had very little relief. She presented to our office in July of 2005. Her rheumatoid factor was almost 1,000. Her anti-nuclear antibody was 1,446. She wanted to try something less toxic. Her pain index was 10. We weaned her off the rheumatology drugs. She continued with visits to her rheumatologist. He was very angry that she stopped these things. He told her that she had terrible autoimmune disease, nothing could be done. Put her on low-dose naltrexone at bedtime. Alpha-lipoic acid intravenously twice a week. And I put her on the antibiotic minocycline, 100 milligrams every day, and with a healthy lifestyle. In June of '06, 11 months later, her pain index fell from 10 to 2, and the patient feels almost normal. Her rheumatoid level fell from 969 to 131. Her ANA fell from 1446 to 131. Mrs. AE today, 50 months later, very little joint pain on ALA and naltrexone. She's also on some Motrin. And I changed her minocycline to Biaxin, clarithromycin, 250 milligrams every day, and she also takes probiotics. Pretty normal most of the time. She has severe osteoporosis from the steroids that she was on for many years. Here we could see some typical patients with rheumatoid arthritis and their original rheumatoid factors. And within 6 months to a year, we see these kind of falls in rheumatoid factor. And here's just some other patients. LDN seems to work very, very well for systemic lupus. SLE, systemic lupus erythematosus, predominant in women, usually a positive ANA. It's a multi-system inflammatory disease. It can be caused by drugs or toxin-induced. Some people are genetically prone to this. This is the typical rash of somebody with SLE. This rash usually does not occur in the nasal labial folds. Some of the manifestations of SLE, problems with the lung, heart problems, kidney, lupus nephritis, arthritic problems, problems with Raynaud's. And this is the glomerulus of a kidney. This is often affected in lupus and can be very serious. Mrs. RAR, a patient with SLE, first seen in 2003, weaned off several drugs that made her very sick. They did not help her feel better. In 2003, her ANA was 1280, 1 to 1280, that's the titer. 2009, it was 0. Here's a group of people with systemic lupus, and when we first saw them, they had high ANAs, and within a short time, in most cases, their ANAs fell dramatically, and the people felt much better or completely normal. Then the other day, I took 56 patients at random that seemed to be fairly adherent to the program. And over here, I averaged, I actually added up all of their ANAs and divided it by 56, which came to 700. And this is 6 months to 1 year later. I took all of the ANAs, divided by 56. You can see there was a dramatic change in ANA levels with low-dose naltrexone, plus in most cases ANA. So these are some very interesting cases. Several people who were diagnosed with terminal metastatic cancer are alive, and some are doing very well. They don't even know they have cancer anymore. They feel normal. Many are not doing well. Many have died. At one time, we took most of the local people who were told they were terminal, and oftentimes a relative brought them in. They didn't want to be there. I don't know, once somebody from a big medical center tells someone that they have a short time to live, people often have a short time to live. They believe these folks and die on schedule. Other people are not that way and are very skeptical and cynical about big organizations, and often they don't die. The best low-dose naltrexone results we get are with autoimmune disease. Most improve greatly.